Question 1. The control framework reveals a client requesting a specific essential oil for a condition, but your professional knowledge and available evidence suggest this oil may not be the safest or most effective choice and could potentially interact with their current medication. What is the most ethically sound and professionally responsible course of action? Option A. Discuss the potential risks and benefits of the requested oil. Explain why it might not be the best option given their medication, and offer evidence-based alternative essential oils or therapeutic approaches that are safer and more appropriate for their condition, ensuring the client makes an informed decision. Option B. Immediately administer the requested essential oil as the client has requested it, trusting their judgment over your professional assessment. Option C. Refuse to use the requested essential oil outright, stating it is not appropriate without further explanation or offering alternatives. Option D. Use the requested essential oil, but omit any mention of potential risks or interactions with their medication to avoid alarming the client. The correct answer is A. Discuss the potential risks and benefits of the requested oil, explain why it might not be the best option given their medication, and offer evidence-based alternative essential oils or therapeutic approaches that are safer and more appropriate for their condition, ensuring the client makes an informed decision. Explanation. This scenario is professionally challenging due to the inherent conflict between a client's stated preference and the aromatherapist's professional judgment regarding safety and efficacy. The client's desire for a specific essential oil, despite potential contraindications or lack of evidence for their stated purpose, necessitates a careful balancing act between client autonomy and the aromatherapist's duty of care. The professional must navigate this by prioritizing client well-being, while respecting their right to make informed decisions. The correct approach represents best professional practice because it upholds the core ethical principles of beneficence, acting in the client's best interest, non-maleficence, avoiding harm, and informed consent. By thoroughly explaining the risks and benefits, offering evidence-based alternatives, and documenting the discussion and the client's final decision, the aromatherapist ensures the client is empowered to make an informed choice. This aligns with professional standards that mandate transparency, evidence-based practice, and client-centered care. An incorrect approach that involves immediately acceding to the client's request without further discussion or assessment fails to uphold the duty of care and the principle of non-maleficence. This could lead to adverse reactions or ineffective treatment, violating professional obligations. Another incorrect approach, that of outright refusal without providing alternatives or explanation, undermines client autonomy and can damage the therapeutic relationship, failing to meet the standard of client-centered care. A third incorrect approach, which involves using the requested oil but downplaying potential risks, constitutes a breach of informed consent and honesty, potentially leading to harm and professional misconduct. Professionals should employ a decision-making framework that begins with active listening to understand the client's needs and desires. This is followed by a comprehensive assessment of the client's health status and contraindications. Next, the professional should clearly communicate evidence-based information regarding the safety and efficacy of proposed treatments, including any risks associated with the client's preferred option. Alternatives should be presented, and the client's informed consent must be obtained for the chosen course of action. Finally, all discussions and decisions should be meticulously documented. Question 2. Regulatory review indicates that a client presents with a request for a specific essential oil, citing anecdotal success from a friend. The clinical aromatherapist has concerns about potential contraindications for this client based on their medical history. What is the most appropriate course of action? Option A. Refuse to recommend the essential oil without providing any explanation or alternative suggestions. Option B. Conduct a thorough client consultation to assess individual needs and contraindications, discuss the risks and benefits of the requested oil, and explore alternative, safer options if necessary, ensuring informed consent. Option C. Immediately recommend the essential oil as requested by the client, prioritizing their stated preference. Option D. Provide the essential oil to the client without further discussion, assuming the client is aware of any potential risks. The correct answer is B. Conduct a thorough client consultation to assess individual needs and contraindications, discuss the risks and benefits of the requested oil, and explore alternative, safer options if necessary, ensuring informed consent. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the clinical aromatherapist to balance client autonomy and informed consent with their professional responsibility to provide safe and evidence-informed recommendations. The client's personal preference for a specific essential oil, based on anecdotal evidence, conflicts with the aromatherapist's knowledge of potential contraindications and the need for a personalized assessment. Navigating this requires careful communication, education, and a commitment to client well-being above all else. Correct approach analysis. The correct approach represents best professional practice because it prioritizes client safety and informed decision-making, aligning with the core ethical principles of clinical aromatherapy. By conducting a thorough client consultation, assessing individual needs and contraindications, and then educating the client on the risks and benefits of their preferred oil versus alternatives, the aromatherapist upholds their duty of care. This approach ensures that any recommendations are tailored to the individual, minimizing potential harm and maximizing therapeutic benefit, in accordance with professional standards and regulatory expectations for client-centered care. Incorrect approaches analysis. Recommending the essential oil without further assessment, despite the client's request, fails to uphold the professional duty of care. This approach disregards potential contraindications and individual sensitivities, which could lead to adverse reactions, violating ethical obligations and potentially regulatory guidelines that mandate personalized care. Directly refusing the client's request without providing an explanation or alternative options demonstrates a lack of client-centered communication and disrespect for client autonomy. This can erode trust and may not align with professional standards that encourage collaborative decision-making. Providing the essential oil solely based on the client's request, without any professional guidance or warning about potential risks, is a significant ethical and regulatory failure. This abdication of professional responsibility places the client at undue risk and is contrary to the principles of safe and effective practice. Professional reasoning. Professionals should employ a decision-making framework that begins with a comprehensive client assessment. This includes understanding their health history, current conditions, medications, and any specific concerns or preferences. Following the assessment, the professional should educate the client about the relevant essential oils, including their properties, potential benefits, and importantly, any contraindications or risks specific to the client's situation. The decision should then be a collaborative one, made with the client's full informed consent, ensuring they understand the rationale behind the chosen approach and any alternatives. Question 3. Strategic planning requires a clinical aromatherapist to meticulously evaluate the essential oils intended for client use. When considering the procurement of a new batch of lavender essential oil, what is the most critical factor to ascertain to ensure it meets professional standards and client safety requirements? Option A. The essential oil is labeled as therapeutic grade and comes from a well-known and reputable supplier. Option B. The essential oil is the most cost-effective option available from a supplier with a generally good market presence. Option C. Verification of the specific extraction method used, e.g., steam distillation, cold pressing, and evidence of third-party laboratory testing for purity and chemical composition. Option D. The essential oil has a pleasant aroma and is recommended by other practitioners for general use. The correct answer is C. Verification of the specific extraction method used, e.g., steam distillation, cold pressing, and evidence of third-party laboratory testing for purity and chemical composition. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a clinical aromatherapist to navigate the complex landscape of essential oil sourcing and quality assurance, directly impacting client safety and therapeutic efficacy. The challenge lies in discerning genuine quality from marketing claims, especially when faced with varying extraction methods and the potential for adulteration, all within the specific regulatory framework governing clinical aromatherapy practice. Correct approach analysis. The correct approach represents best professional practice because it prioritizes client well-being and adheres to the foundational principles of clinical aromatherapy as defined by its regulatory framework. This involves a thorough understanding of essential oil definitions, the implications of different extraction methods on chemical profiles, and the critical importance of quality standards. By demanding verifiable documentation of extraction methods and third-party testing for purity and potency, the aromatherapist ensures that the oils used are safe, effective, and compliant with professional guidelines. This proactive stance mitigates risks associated with substandard or adulterated oils, upholding the integrity of the profession and client trust. Incorrect approaches analysis. One incorrect approach fails by accepting essential oils based solely on marketing descriptions and anecdotal evidence. This is a regulatory and ethical failure because it bypasses the need for objective verification of quality and safety. The regulatory framework for clinical aromatherapy emphasizes evidence-based practice and due diligence, which cannot be satisfied by marketing claims alone. Ethically, it exposes clients to potential harm from impure or incorrectly identified oils. Another incorrect approach is to prioritize cost-effectiveness over documented quality. This represents a significant regulatory and ethical lapse. While financial prudence is important, it must not compromise client safety or the efficacy of treatment. The regulatory framework implicitly mandates that practitioners use materials that meet established quality benchmarks, regardless of minor cost differences. Prioritizing price over quality can lead to the use of adulterated or low-grade oils, violating professional standards and potentially causing adverse reactions. A third incorrect approach involves relying on the reputation of a supplier without seeking specific documentation regarding extraction methods and quality testing for each batch. While supplier reputation is a factor, it is not a substitute for due diligence. The regulatory framework requires practitioners to be able to substantiate the quality of the materials they use. Relying solely on reputation without verifying specific batch information is a failure to meet this standard, leaving the practitioner vulnerable to issues with specific product lines or batches that may not meet the expected quality. Professional reasoning. Professionals should employ a decision-making framework that begins with understanding the core definitions and properties of essential oils, including how extraction methods influence their chemical composition and therapeutic potential. This should be followed by a rigorous assessment of quality standards, demanding verifiable documentation such as certificates of analysis, as that confirm purity, potency, and the absence of contaminants. When evaluating suppliers, the focus should be on their transparency regarding extraction processes and their commitment to independent third-party testing. This systematic approach ensures that all decisions regarding essential oil selection are grounded in scientific evidence, regulatory compliance, and a commitment to client safety and therapeutic outcomes. Question 4. The efficiency study reveals that a specific essential oil blend demonstrates a statistically significant reduction in reported client anxiety levels within a controlled clinical trial. As a clinical aromatherapy professional, how should you best integrate this information into your practice? Option A. Disregard the study's findings, as anecdotal evidence from your personal experience with other anxiety-reducing methods is sufficient for your practice. Option B. Recommend the essential oil blend to clients experiencing anxiety without conducting a full client assessment, relying solely on the study's reported efficiency. Option C. Immediately incorporate the essential oil blend into all anxiety-related client sessions, assuming the study's findings are universally applicable and beneficial for every client. Option D. Critically evaluate the study's methodology and relevance to your client population, and if appropriate, consider incorporating the blend into individualized treatment plans after thorough client assessment and informed consent. The correct answer is D. Critically evaluate the study's methodology and relevance to your client population, and if appropriate, consider incorporating the blend into individualized treatment plans after thorough client assessment and informed consent. Explanation. The efficiency study reveals that a particular essential oil blend, when used in a specific therapeutic setting, shows a statistically significant reduction in reported client anxiety levels. This scenario is professionally challenging because it requires the clinical aromatherapy professional to interpret research findings and apply them ethically and effectively within their practice, considering client safety and regulatory compliance. The CAP must move beyond simply acknowledging the study's results to understanding the implications for client care and professional responsibility. The correct approach represents best professional practice because it prioritizes a holistic and evidence-informed approach to client care. This involves critically evaluating the study's methodology, considering the individual client's needs and contraindications, and integrating the findings into a broader treatment plan. This aligns with the CAP's ethical duty to provide safe and effective care, grounded in current knowledge and best practices, while respecting client autonomy and informed consent. It also implicitly adheres to any professional guidelines that mandate evidence-based practice and ongoing professional development. An incorrect approach that focuses solely on the statistical significance without considering the broader clinical context or individual client factors is professionally unacceptable. This could lead to the indiscriminate application of the essential oil blend, potentially overlooking contraindications or client sensitivities, which poses a risk to client safety and violates the CAP's duty of care. Another incorrect approach that dismisses the study entirely without critical evaluation may represent a failure to stay abreast of relevant research and evidence-based practices, potentially limiting the client's access to beneficial therapeutic interventions. A third incorrect approach that prioritizes the essential oil blend's perceived efficiency over client well-being and individual assessment would be a direct contravention of ethical principles and professional standards, potentially leading to harm and a breach of trust. Professionals should employ a decision-making framework that begins with critically appraising the research, considering its relevance to their scope of practice and client population. This is followed by a thorough client assessment, including a detailed history, identification of contraindications, and discussion of potential benefits and risks. The CAP should then integrate the research findings into a personalized treatment plan, ensuring informed consent is obtained from the client. Ongoing monitoring of the client's response and adjustment of the treatment plan as needed are crucial components of this process. Question 5. Implementation of aromatherapy for a client diagnosed with long-term rheumatoid arthritis requires a comprehensive approach. Which of the following best represents the ethically and professionally sound method for integrating aromatherapy into their chronic illness management plan? Option A. Recommending a blend of essential oils based on popular anecdotal reports for joint pain and inflammation, without consulting the client's physician or considering their specific medication regimen. Option B. Developing a personalized aromatherapy protocol solely based on the client's expressed preferences for certain scents, irrespective of scientific evidence or potential interactions with their prescribed medications. Option C. Suggesting essential oils that have shown some preliminary research for mood enhancement, without addressing the specific physical symptoms of rheumatoid arthritis or inquiring about the client's current medical management. Option D. Collaborating with the client's rheumatologist to understand their current medical treatment, potential contraindications, and to ensure aromatherapy is used as a complementary therapy for symptom relief, while also educating the client on evidence-based applications and potential risks. The correct answer is D. Collaborating with the client's rheumatologist to understand their current medical treatment, potential contraindications, and to ensure aromatherapy is used as a complementary therapy for symptom relief, while also educating the client on evidence-based applications and potential risks. Explanation. The scenario presents a common challenge in clinical aromatherapy, integrating complementary therapies into the management of chronic illness while adhering to professional standards and regulatory expectations. The core difficulty lies in balancing the potential benefits of aromatherapy with the need for evidence-based practice, client safety, and scope of practice limitations, particularly when dealing with complex health conditions. Professionals must navigate the ethical imperative to provide holistic care without overstepping boundaries or making unsubstantiated claims. The correct approach prioritizes a client-centered, evidence-informed, and collaborative strategy. It emphasizes understanding the client's specific chronic illness, their current medical treatment, and their individual needs and preferences. This involves consulting with the client's primary healthcare provider to ensure aromatherapy is complementary and not contradictory to their existing medical management. It also requires the aromatherapist to possess a thorough understanding of the scientific literature supporting the use of specific essential oils for symptom management in chronic conditions, and to clearly communicate the limitations and potential risks. This approach aligns with professional ethical codes that mandate competence, client well-being, and interdisciplinary collaboration. It respects the client's autonomy by involving them in decision-making and ensures that aromatherapy is used as an adjunct to, not a replacement for, conventional medical care. An incorrect approach that focuses solely on anecdotal evidence or personal belief, without considering the client's medical history or consulting with their healthcare team, is professionally negligent. Failure to collaborate with medical professionals can lead to contraindications adverse interactions with prescribed medications, or a delay in seeking appropriate medical treatment, thereby jeopardizing client safety. Such an approach also risks violating professional scope of practice by implying a level of medical diagnosis or treatment that is outside the domain of aromatherapy. Another incorrect approach that involves recommending essential oils for conditions for which there is no robust scientific evidence of efficacy or safety in chronic illness management is ethically unsound. This can lead to false hope, wasted resources, and potential harm if the client relies on ineffective aromatherapy instead of evidence-based medical interventions. It also undermines the credibility of clinical aromatherapy as a profession. A third incorrect approach that neglects to obtain informed consent regarding the use of aromatherapy, its potential benefits, risks, and limitations, is a violation of client autonomy and ethical practice. Clients have the right to understand what they are agreeing to, especially when it involves their health and well-being. The professional decision-making process for similar situations should involve a systematic assessment of the client's condition, a thorough review of relevant scientific literature, consultation with the client's healthcare providers, clear communication with the client regarding expectations and risks, and the development of a personalized, evidence-informed aromatherapy plan that complements conventional medical care. This process ensures that the aromatherapist acts within their scope of practice, prioritizes client safety, and upholds the highest ethical standards. Question 6. Process analysis reveals that a client presents with mild anxiety and sleep disturbances. The clinical aromatherapy professional is considering recommending essential oils. Which of the following approaches best exemplifies adherence to safety guidelines for essential oil use in this context? Option A. Recommending a high concentration of essential oils, such as 10%, for diffusion throughout the client's bedroom overnight to promote deep sleep. Option B. Recommending a blend of essential oils diluted to 2% in a carrier oil for topical application to the pulse points, with clear instructions on avoiding sun exposure for 12 hours if phototoxic oils are included. Option C. Advising the client to ingest a few drops of essential oil daily to address their anxiety internally. Option D. Suggesting the client apply undiluted essential oils directly to the skin to maximize their therapeutic effect. The correct answer is B. Recommending a blend of essential oils diluted to 2% in a carrier oil for topical application to the pulse points, with clear instructions on avoiding sun exposure for 12 hours if phototoxic oils are included. Explanation. This scenario presents a common challenge in clinical aromatherapy, balancing the therapeutic benefits of essential oils with the inherent risks associated with their use, particularly when dealing with vulnerable populations. The professional's responsibility extends beyond simply recommending oils to ensuring safe and appropriate application based on scientific evidence and established safety guidelines. The core of this challenge lies in the need for individualized assessment, understanding contraindications, and adhering to dilution protocols, all within the scope of practice for a clinical aromatherapy professional. The correct approach prioritizes client safety by meticulously assessing individual health status, potential contraindications, and the specific needs of the client. This aligns with the fundamental ethical principle of do no harm and the regulatory expectation for practitioners to operate within their scope of competence, utilizing evidence-based practices, adhering to established dilution guidelines, considering phototoxicity, and avoiding certain oils for specific conditions, e.g., pregnancy, epilepsy, are critical components of safe practice, directly supported by professional standards and often implicitly or explicitly by regulatory frameworks governing complementary therapies. An incorrect approach that involves recommending undiluted essential oils for topical application is a significant regulatory and ethical failure. It directly violates established safety protocols and increases the risk of adverse reactions such as skin irritation, sensitization, or even systemic toxicity. Recommending oils without considering contraindications, such as using phototoxic oils before sun exposure or oils with potential neurotoxic effects in individuals with seizure disorders, demonstrates a lack of due diligence and a failure to uphold the duty of care. Furthermore, recommending essential oils for serious medical conditions without consulting or referring to a qualified medical professional falls outside the scope of practice for a clinical aromatherapy professional and could be construed as practicing medicine without a license, a serious regulatory offense. Professionals should employ a decision-making process that begins with a thorough client consultation, including a detailed health history. This should be followed by an evidence-based assessment of the suitability of specific essential oils, considering contraindications, potential interactions, and appropriate dilution ratios for the intended application. Continuous professional development and staying abreast of current research and safety guidelines are paramount. When in doubt, or when a client presents with complex medical conditions, referral to a medical doctor or other appropriate healthcare provider is the ethically and professionally responsible course of action. Question 7. Strategic planning requires a clinical aromatherapist to develop a personalized aromatic blend for a client experiencing both significant anxiety and chronic insomnia. The client has also mentioned a recent diagnosis of mild hypertension and is taking a prescribed beta blocker. Considering the therapeutic properties of essential oils and the client's health profile, which of the following approaches best aligns with professional best practices for developing this blend? Option A. Advise the client to use a broad-spectrum essential oil blend containing a variety of oils commonly associated with relaxation, such as ylang-ylang Cananga odorata, frankincense, Boswellia cartieri, and vetiver, Vetiveria zizanioides, without specific consideration for the hypertension or medication. Option B. Recommend a blend of essential oils known for their uplifting and energizing scents, such as bergamot citrus bergamia and peppermint menthopiprida, as a way to combat the negative feelings associated with anxiety and improve overall mood, which may indirectly aid sleep. Option C. Focus solely on essential oils that the client has previously expressed a liking for, regardless of their specific therapeutic actions or potential impact on hypertension and medication, to ensure client satisfaction and adherence. Option D. Select essential oils with well-documented anxiolytic and sedative properties, such as lavender, Lavandula angustifolia, and Roman chamomile, Chamomillum nobile, while carefully reviewing potential interactions with the client's beta blocker and ensuring no contraindications exist for hypertension. The correct answer is D. Select essential oils with well-documented anxiolytic and sedative properties, such as lavender, Lavandula angustifolia, and Roman chamomile, Chamomillum nobile, while carefully reviewing potential interactions with the client's beta blocker and ensuring no contraindications exist for hypertension. Explanation. Scenario analysis. This scenario presents a common challenge in clinical aromatherapy, where a practitioner must select essential oils for a client with multiple, potentially overlapping health concerns. The challenge lies in balancing the client's stated preferences and perceived needs with the evidence-based therapeutic properties of essential oils, while also considering potential contraindications and interactions. Professional judgment is required to avoid oversimplification and ensure a safe and effective treatment plan. Correct approach analysis. The correct approach prioritizes a holistic assessment that considers the client's overall health status, current medications, and any known sensitivities. It then involves selecting essential oils with therapeutic properties that directly address the identified issues, such as anxiety and sleep disturbances, while also being mindful of synergistic effects and potential contraindications. This aligns with the principles of safe and ethical practice within clinical aromatherapy, emphasizing individualized care and evidence-informed selection. The focus on understanding the specific therapeutic actions of each oil e.g., anxiolytic, sedative, and their documented efficacy for the client's conditions is paramount. Incorrect approach is analysis. One incorrect approach involves solely relying on the client's subjective requests without a thorough assessment of their underlying health conditions or potential contraindications. This could lead to the selection of oils that, while perceived as desirable by the client, may be ineffective or even harmful given their medical history or current treatments. This fails to meet the professional standard of care, which mandates a comprehensive client evaluation. Another incorrect approach is to select oils based on anecdotal evidence or popular trends without consulting reliable scientific literature or established clinical guidelines. This disregards the evidence-based foundation of clinical aromatherapy and risks recommending oils with unproven efficacy or unknown safety profiles for the client's specific needs. This constitutes a failure to adhere to professional standards of practice that require practitioners to be knowledgeable about the scientific basis of their recommendations. A further incorrect approach is to recommend a broad spectrum of oils without a clear rationale for each, hoping that one will be effective. This lacks the precision and targeted application expected in clinical practice. It fails to demonstrate a clear understanding of the specific therapeutic properties of each oil and how they contribute to the overall treatment plan, potentially leading to an overwhelming or ineffective aromatic experience for the client. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough client consultation and assessment. This includes gathering information on their health history, current symptoms, lifestyle, and any existing medical conditions or treatments. Following this, practitioners should consult reputable resources, such as peer-reviewed research, established aromatherapy texts, and professional guidelines, to identify essential oils with scientifically supported therapeutic properties relevant to the client's concerns. The selection process should then involve a careful consideration of potential contraindications, drug interactions, and individual client sensitivities. Finally, the chosen oils should be integrated into a personalized treatment plan, with clear instructions for safe and effective use, and a plan for follow-up and evaluation. Question 8. The assessment process reveals a client presenting with symptoms of chronic stress, including frequent headaches, difficulty concentrating, and a feeling of being constantly on edge. The client reports no significant pre-existing medical conditions, but is taking a mild over-the-counter analgesic for the headaches. Considering the client's presentation and the nervous system's response to stress, which of the following approaches best aligns with the CAP regulatory framework for clinical aromatherapy? Option A. Recommend a complex blend of essential oils with a focus on deep relaxation techniques, without specifically inquiring about the client's analgesic use or potential interactions. Option B. Recommend a blend of essential oils known for their calming properties, such as lavender and chamomile, after a thorough review of the client's medical history and current medications, and discuss potential synergistic effects with the analgesic. Option C. Suggest a potent blend of essential oils with strong stimulant properties to help the client overcome their fatigue and improve concentration. Option D. Advise the client to use a single essential oil, such as peppermint, diffused continuously throughout the day to address the headaches and improve focus. The correct answer is B. Recommend a blend of essential oils known for their calming properties, such as lavender and chamomile, after a thorough review of the client's medical history and current medications, and discuss potential synergistic effects with the analgesic. Explanation. The assessment process reveals a client experiencing significant symptoms of chronic stress, including persistent muscle tension, sleep disturbances, and heightened anxiety. This scenario is professionally challenging because it requires the clinical aromatherapist to navigate the complex interplay between the nervous system's stress response and the potential benefits and contraindications of essential oils. Accurate assessment and a nuanced understanding of physiological responses are paramount to ensure client safety and therapeutic efficacy, adhering strictly to the CAP regulatory framework. Correct approach involves a comprehensive assessment of the client's overall health, including their medical history, current medications, and specific stress triggers, before recommending any essential oils. This aligns with the CAP's emphasis on a holistic and evidence-informed practice, prioritizing client well-being and safety. The selection of essential oils should be based on their known effects on the nervous system, such as calming, grounding, or adaptogenic properties, and their suitability for the client's individual presentation, always considering potential contraindications and interactions. This approach ensures that the aromatherapy intervention is safe, ethical, and therapeutically sound, reflecting best professional practice as mandated by the CAP guidelines. An incorrect approach would be to recommend essential oils solely based on popular associations with stress relief without a thorough client assessment. This fails to consider individual sensitivities, potential adverse reactions, or interactions with existing health conditions or medications, which is a direct violation of the CAP's duty of care and safety protocols. Another incorrect approach would be to suggest essential oils for conditions that fall outside the scope of clinical aromatherapy practice, such as severe psychological disorders requiring medical intervention, without appropriate referral. This demonstrates a lack of understanding of professional boundaries and the limitations of aromatherapy, contravening CAP ethical guidelines that require practitioners to recognize when to refer clients to other healthcare professionals. Recommending essential oils without considering the client's specific physiological response to stress, such as identifying whether the stress is primarily sympathetic or parasympathetic dominant, would also be an inadequate approach, potentially leading to an ineffective or even exacerbating intervention. Professionals should employ a decision-making framework that begins with a thorough client intake and assessment, followed by a review of relevant scientific literature and established aromatherapy protocols. This framework necessitates critical evaluation of the client's presentation against potential essential oil actions and contraindications, prioritizing safety and efficacy. When in doubt, consultation with other healthcare professionals or senior aromatherapists is a crucial step, ensuring adherence to the highest standards of professional conduct and client care as outlined by the CAP. Question 9. Investigation of the most appropriate method for a clinical aromatherapy professional CAP to integrate aromatherapy into a client's holistic health plan, considering their existing medical treatments and overall well-being. Option A. Developing a comprehensive aromatherapy protocol to address the client's diagnosed medical condition, advising them to discontinue their current medical treatments in favor of aromatherapy. Option B. Collaborating with the client's primary healthcare provider to ensure the aromatherapy plan is safe, appropriate, and complementary to their existing medical care, after a thorough client assessment and discussion of goals. Option C. Providing a list of popular essential oils for relaxation and stress relief, assuming that these are universally safe and beneficial for all individuals seeking holistic health support. Option D. Recommending a selection of essential oils based on the client's expressed interest in general wellness, without inquiring about their medical history or consulting with their physician. The correct answer is B. Collaborating with the client's primary healthcare provider to ensure the aromatherapy plan is safe, appropriate, and complementary to their existing medical care, after a thorough client assessment and discussion of goals. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the clinical aromatherapy professional, CAP, to navigate the integration of aromatherapy into a client's broader holistic health plan while adhering to specific regulatory frameworks. The challenge lies in ensuring that the proposed aromatherapy interventions are evidence-informed, safe, and do not overstep the scope of practice for an aromatherapist, especially when complementary to conventional medical treatment. The CAP must balance client autonomy and preferences with professional responsibility and regulatory boundaries. Correct approach analysis. The correct approach emphasizes a collaborative and informed process. It involves a thorough assessment of the client's overall health status, including any existing medical conditions and treatments, and a discussion of their goals and preferences. Crucially, it necessitates consultation with the client's primary healthcare provider to ensure that the aromatherapy plan is safe, appropriate, and complementary to their existing medical care. This aligns with the ethical principles of client well-being, informed consent, and professional responsibility, as well as any relevant regulatory guidelines that mandate interdisciplinary communication for client safety and integrated care. The focus is on providing supportive care within the scope of aromatherapy practice, not on replacing or contradicting medical advice. Incorrect approach is analysis. An approach that solely focuses on the client's stated preferences without considering their medical history or consulting with their physician is ethically and regulatorily flawed. This could lead to contraindications, adverse reactions, or interference with prescribed medical treatments, violating the duty of care and potentially breaching regulatory requirements for safe practice. Another incorrect approach would be to recommend specific essential oils or blends without a comprehensive understanding of the client's health status, potential contraindications, or the scientific evidence supporting their use for the stated holistic health goals. This demonstrates a lack of due diligence and could result in ineffective or harmful interventions, failing to meet professional standards and regulatory expectations for evidence-informed practice. Furthermore, an approach that positions aromatherapy as a sole or primary treatment for a medical condition, without acknowledging or integrating with conventional medical care, is a significant ethical and regulatory failure. This oversteps the scope of practice for a CAP and could lead to a delay in appropriate medical treatment for the client. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a comprehensive client assessment. This includes gathering information about their health history, current medical treatments, lifestyle, and personal goals. The next critical step is to establish clear communication channels with the client's healthcare team To ensure a coordinated and safe approach, professionals must then apply their knowledge of aromatherapy, including contraindications and evidence-based applications, to develop a personalized plan that complements, rather than replaces, conventional medical care. Throughout this process, maintaining client confidentiality and obtaining informed consent are paramount, all within the defined scope of practice and regulatory guidelines. Question 10. What factors determine the appropriate and safe application of essential oils for supporting hormonal balance in a client, considering their individual physiological status and current health interventions? Option A. The popularity of specific essential oils for general well-being and their perceived ability to address common symptoms associated with hormonal fluctuations. Option B. A comprehensive assessment of the client's medical history, current medications, lifestyle, and specific hormonal concerns, coupled with an understanding of the scientific literature on essential oil effects on the endocrine system and adherence to established safety guidelines. Option C. A generalized approach based on common hormonal imbalances, recommending a standard blend of essential oils known for their relaxing properties. Option D. The aromatherapist's personal experience and anecdotal evidence of success with certain essential oils in managing hormonal issues. The correct answer is B. A comprehensive assessment of the client's medical history, current medications, lifestyle, and specific hormonal concerns, coupled with an understanding of the scientific literature on essential oil effects on the endocrine system and adherence to established safety guidelines. Explanation. The scenario of a clinical aromatherapist advising a client on essential oil use for hormonal balance presents a significant professional challenge due to the inherent complexity of the endocrine system and the potential for unintended physiological effects from essential oils. It requires a deep understanding of both aromatherapy principles and the client's individual health status, moving beyond simple symptom management to address underlying systemic influences. Careful judgment is crucial to ensure client safety and therapeutic efficacy, avoiding oversimplification or unsubstantiated claims. The correct approach represents best professional practice because it prioritizes a holistic and evidence-informed methodology. This involves a thorough client assessment that includes understanding their medical history, current medications, lifestyle, and specific hormonal concerns. It necessitates consulting peer-reviewed research and established safety guidelines for essential oil use in relation to endocrine function, recognizing that hormonal balance is a delicate interplay of multiple glands and feedback loops. Ethical practice dictates that the aromatherapist acts within their scope of practice, referring to qualified medical professionals for diagnosis and treatment of endocrine disorders. This approach upholds the principle of do no harm by ensuring that interventions are safe, appropriate, and integrated with conventional medical care where necessary. An incorrect approach that focuses solely on a single essential oil for a broad hormonal issue, without considering the client's full health profile or scientific evidence, represents a significant regulatory and ethical failure. This could lead to adverse effects, such as exacerbating existing hormonal imbalances or interacting negatively with medications, violating the duty of care owed to the client. Another incorrect approach that relies on anecdotal evidence or unsubstantiated claims about essential oils' ability to cure hormonal imbalances is ethically problematic and potentially misleading, as it may deter clients from seeking appropriate medical attention. Furthermore, making definitive claims about hormonal regulation without a medical background or diagnostic tools falls outside the scope of practice for a clinical aromatherapist, potentially constituting the unauthorized practice of medicine. The professional decision-making process for similar situations should involve a structured assessment framework. This includes 1. Comprehensive client intake, gathering detailed information on health history, symptoms, medications, and lifestyle. 2. Evidence-based research, consulting reputable scientific literature and safety databases regarding the specific essential oils and their potential impact on the endocrine system. 3. Scope of practice awareness, clearly defining the boundaries of aromatherapy practice and identifying when referral to a medical practitioner is necessary. 4. Risk-benefit analysis, evaluating the potential benefits of essential oil use against any known risks for the individual client. 5. Informed consent, ensuring the client fully understands the proposed interventions, their limitations, and potential side effects. 6. Ongoing monitoring and evaluation, regularly assessing the client's response to the aromatherapy intervention and adjusting the plan as needed in collaboration with their healthcare providers. Question 11. When evaluating the potential synergistic effects of essential oils for a client experiencing chronic muscle tension and anxiety, which blending approach best aligns with the principles of safe and effective clinical aromatherapy practice? Option A. Choosing oils primarily based on personal preference and past positive experiences with similar blends, without extensive research into their specific interactions or contraindications. Option B. Incorporating a large number of essential oils, assuming that a greater variety will lead to a more potent and comprehensive therapeutic outcome, regardless of specific synergistic evidence. Option C. Selecting oils based on their known individual properties for muscle relaxation and anxiety reduction, researching their documented synergistic interactions, and considering the client's specific health profile and contraindications before formulating the blend. Option D. Combining a wide array of essential oils that are anecdotally reported to be beneficial for both conditions, prioritizing a complex and appealing fragrance profile. Correct answer is C. Selecting oils based on their known individual properties for muscle relaxation and anxiety reduction, researching their documented synergistic interactions, and considering the client's specific health profile and contraindications before formulating the blend. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the aromatherapist to move beyond simple ingredient selection to understanding the complex interplay of essential oils and their potential synergistic effects. This involves not only knowledge of individual oil properties, but also an awareness of how these properties might be amplified, altered, or even counteracted when combined. The challenge lies in predicting and achieving a desired therapeutic outcome while ensuring client safety and adhering to professional standards. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a systematic, evidence-informed, and client-centered methodology. This involves understanding the biochemical constituents of each oil, researching their known synergistic interactions, and considering the client's specific needs and contraindications. This aligns with the ethical imperative to provide safe and effective care, grounded in current knowledge and professional guidelines. It demonstrates a commitment to ongoing learning and a responsible application of aromatherapy principles, ensuring that blends are not haphazard, but are thoughtfully constructed for optimal therapeutic benefit and minimal risk. Incorrect approach is analysis. An approach that relies solely on personal preference or anecdotal evidence without scientific or clinical backing is professionally unacceptable. This fails to meet the standard of care expected of a clinical aromatherapy professional, potentially leading to ineffective or even harmful applications. It disregards the importance of understanding the complex chemistry of essential oils and their interactions. An approach that prioritizes creating a pleasant aroma above all else, without considering the therapeutic goals or potential contraindications, is also professionally unsound. While aroma is a component of aromatherapy, it should not overshadow the primary objective of therapeutic intervention. This approach risks overlooking crucial safety considerations and the potential for adverse reactions, violating the duty of care. An approach that involves combining a large number of essential oils without a clear rationale or understanding of their combined effects is risky. This more is better mentality can lead to unpredictable outcomes, increased potential for sensitization, and a dilution of the intended therapeutic action of individual oils. It lacks the precision and thoughtful consideration required for effective and safe blending. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough client assessment, including their health history, current condition, and therapeutic goals. This is followed by research into essential oils known to address these goals, with a specific focus on their chemical profiles and documented synergistic or antagonistic interactions. The selection process should then consider safety, contraindications, and the client's individual sensitivities. Finally, the blend should be formulated with a clear rationale for each oil's inclusion and its intended contribution to the overall therapeutic effect, with a plan for monitoring client response. Question 12. The audit findings indicate a need to clarify the appropriate application of essential oils in supporting immune system function. Which of the following approaches best reflects the current understanding and regulatory framework for clinical aromatherapy professionals, CAP, regarding immune support? Option A. recommending essential oils known for their adaptogenic properties to help the body better manage stress, which in turn can positively influence immune resilience. Option B, advising clients that specific essential oils can significantly increase their white blood cell count, thereby boosting immunity. Option C, promoting the use of essential oils as a primary treatment to cure viral infections. Option D, suggesting essential oils that can directly eliminate pathogens from the bloodstream to prevent illness. The correct answer is A, recommending essential oils known for their adaptogenic properties to help the body better manage stress, which in turn can positively influence immune resilience. Explanation: the audit findings indicate a need to review the clinical aromatherapy professionals' understanding of immune system function and essential oil interactions, specifically concerning their application in supporting immune health. This scenario is professionally challenging because it requires the practitioner to navigate the complex interplay between physiological processes and the pharmacological effects of essential oils, while adhering strictly to the scope of practice and evidence-based guidelines relevant to the clinical aromatherapy professional (CAP) certification. Misinterpreting immune system responses or the efficacy of essential oils can lead to inappropriate recommendations, potentially compromising client safety and undermining professional credibility. The correct approach represents best professional practice because it prioritizes a nuanced understanding of how specific essential oils may influence immune pathways, such as modulating inflammatory responses or supporting cellular defense mechanisms, without making unsubstantiated claims of disease prevention or treatment. This aligns with the CAP's commitment to evidence-informed practice and ethical client care, ensuring that recommendations are based on current scientific understanding and within the scope of aromatherapy. It emphasizes a holistic approach that considers individual client needs and potential contraindications, thereby promoting client well-being and safety. An incorrect approach that suggests essential oils can directly boost the immune system by increasing white blood cell counts, without specific scientific evidence for that mechanism, is professionally unacceptable. This oversimplifies complex biological processes and makes unsubstantiated claims, violating ethical guidelines that prohibit making therapeutic claims beyond the scope of aromatherapy practice and the available scientific literature. It also fails to acknowledge the potential for adverse effects or interactions. Another incorrect approach that focuses solely on the antimicrobial properties of essential oils for general immune support, without considering the broader context of immune system function, e.g., adaptive immunity, inflammatory regulation, is also professionally flawed. While some essential oils possess antimicrobial activity, this is only one facet of immune support. Relying exclusively on this aspect ignores other crucial immune functions and may lead to an incomplete or imbalanced approach to client care. This demonstrates a lack of comprehensive understanding of immunology and aromatherapy's role within it. A third incorrect approach that advocates for the use of essential oils to kill viruses or fight off infections directly is a significant regulatory and ethical failure. Such claims are medical in nature and fall outside the scope of practice for a clinical aromatherapy professional. They constitute unsubstantiated therapeutic claims, which are strictly prohibited and can have serious legal and ethical repercussions, potentially misleading clients about the capabilities of aromatherapy and delaying appropriate medical intervention. The professional decision-making process for similar situations should involve a thorough review of current scientific literature, adherence to the CAP's scope of practice and ethical code, and a commitment to providing evidence-informed, client-centered care. Practitioners must critically evaluate claims about essential oil efficacy, distinguishing between scientifically supported mechanisms of action and unsubstantiated assertions. When in doubt, consulting with qualified healthcare professionals or seeking further education is paramount to ensure safe and effective practice. Question 13. Cost-benefit analysis shows that while incorporating new essential oils can broaden therapeutic options, the potential for adverse reactions necessitates a cautious approach. A client with a history of skin sensitivities and a known allergy to pollen is interested in a blend that includes a new essential oil, Rose Otto. What is the most appropriate course of action for the clinical aromatherapist? Option A. Rely solely on the client's statement that they have no known allergies to floral essential oils and proceed with using Rose Otto in the blend. Option B. Refuse to use Rose Otto essential oil altogether due to the client's history of sensitivities and pollen allergy. opting for only well-established oils. Option C. Immediately incorporate Rose Otto essential oil into the client's blend as standard dilution, assuming that since it is a natural product, it is unlikely to cause a significant reaction. Option D. Perform a patch test with a diluted solution of Rose Otto essential oil on a small area of skin and monitor for any adverse reactions before incorporating it into a larger blend. The correct answer is D. Perform a patch test with a diluted solution of Rose Otto essential oil on a small area of skin and monitor for any adverse reactions before incorporating it into a larger blend. Explanation: this scenario presents a professional challenge due to the inherent risk of adverse reactions when introducing new essential oils to a client with a history of sensitivities. The core of the challenge lies in balancing the client's desire for a personalized blend with the aromatherapist's ethical and professional responsibility to ensure client safety. Careful judgment is required to navigate potential contraindications and allergies without unnecessarily restricting therapeutic options. The correct approach represents best professional practice because it prioritizes client safety and informed consent, aligning with the core principles of clinical aromatherapy. This involves a thorough client consultation, including a detailed review of their medical history, known allergies, and previous reactions to any substances, including essential oils. The proposed introduction of a new oil is then managed through a controlled, low-risk method, such as a patch test, to assess for immediate adverse reactions. This proactive measure directly addresses potential contraindications and allergies before widespread application, minimizing the risk of a significant allergic response or adverse event. This aligns with the ethical duty of care and the regulatory expectation for practitioners to conduct thorough risk assessments. An incorrect approach that involves immediately incorporating the new essential oil into a full blend without prior testing fails to adequately assess for contraindications and allergies. This constitutes a significant regulatory and ethical failure, as it disregards the potential for an adverse reaction, which could range from mild skin irritation to a severe systemic allergic response. Such an action breaches the duty of care owed to the client and could lead to harm, potentially violating professional standards and guidelines that mandate a cautious and evidence-based approach to client care. Another incorrect approach, which is to refuse to use any new essential oils due to a general fear of allergies, is also professionally unsound. A caution is warranted. An overly restrictive approach can limit the therapeutic benefits available to the client and may not be supported by the specific regulatory framework, which encourages personalized care within safe parameters. This approach fails to demonstrate a nuanced understanding of risk management and may not be justifiable under the principle of providing the most appropriate care. A further incorrect approach, such as relying solely on the client's self-reported absence of allergies without further inquiry or testing, is insufficient. While client input is vital, it does not absolve the practitioner of their responsibility to conduct their own due diligence. Many allergies can be latent or manifest in unexpected ways, and a professional practitioner must employ established protocols for identifying and mitigating risks. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive client assessment. Gather detailed information on medical history, current conditions, medications, known sensitivities, and previous experiences with aromatherapy. 2. Risk identification. Based on the assessment, identify potential contraindications and allergies relevant to the proposed essential oils. 3. Risk mitigation strategy. Develop a plan to safely introduce new oils, which may include dilution, patch testing, or avoiding certain oils altogether. 4. Informed consent. Clearly communicate potential risks and benefits to the client, explaining the rationale behind the chosen approach and obtaining their agreement. 5. Monitoring and evaluation. Observe the client for any adverse reactions during and after the application and adjust the treatment plan accordingly. Question 14. Quality control measures reveal a client expressing significant emotional distress and stating a desire to work through their feelings using aromatherapy. The aromatherapist has been trained in the psychological aspects of aromatherapy and understands how certain essential oils can influence mood and emotional states. What is the most appropriate professional response? Option A. Directly engage in therapeutic conversation, asking probing questions about the root causes of their distress and offering interpretations of their emotional experiences. Option B. Focus exclusively on the physical benefits of aromatherapy, such as pain relief or improved sleep, and avoid any discussion of the client's emotional state. Option C. Recommend specific essential oils with strong claims of being able to cure anxiety and depression, assuring the client that aromatherapy alone will resolve their psychological issues. Option D. Acknowledge the client's emotional state. Offer to create a personalized aromatic blend to support their mood and promote relaxation, and suggest they consider consulting a mental health professional for deeper emotional processing. The correct answer is D. Acknowledge the client's emotional state. Offer to create a personalized aromatic blend to support their mood and promote relaxation, and suggest they consider consulting a mental health professional for deeper emotional processing. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the aromatherapist to navigate the delicate balance between providing supportive care and avoiding the unauthorized practice of psychology or therapy. The client's expressed desire for emotional processing through aromatherapy necessitates a clear understanding of the aromatherapist's scope of practice, as defined by the Clinical Aromatherapy Professional (CAP) regulatory framework. Misinterpreting the client's needs or overstepping professional boundaries could lead to ineffective or even harmful outcomes and potential regulatory violations. Correct approach analysis. The correct approach involves acknowledging the client's emotional state and offering aromatherapy as a complementary modality to support their well-being, while clearly delineating the boundaries of aromatherapy practice. This aligns with the CAP framework's emphasis on holistic support and client-centered care, recognizing that essential oils can influence mood and emotional states. The professional's role is to provide safe and appropriate aromatic interventions, not to conduct psychological therapy. This approach respects the client's autonomy and promotes a collaborative relationship where the client's emotional journey is supported within the scope of aromatherapy practice. Incorrect approaches analysis. One incorrect approach involves directly engaging in psychological counseling or offering therapeutic advice for the client's emotional distress. This constitutes the unauthorized practice of psychology or therapy, which is a serious regulatory and ethical violation under the CAP framework. Aromatherapists are not licensed mental health professionals, and attempting to provide such services can lead to harm and legal repercussions. Another incorrect approach is to dismiss or ignore the client's expressed emotional needs, focusing solely on the physical aspects of aromatherapy. While maintaining professional boundaries is crucial, completely disregarding the psychological impact of essential oils and the client's subjective experience is not client-centered and can undermine the therapeutic relationship. This fails to acknowledge the holistic nature of aromatherapy and its potential influence on emotional well-being. A third incorrect approach is to make definitive claims about the ability of specific essential oils to cure or resolve deep-seated psychological issues. Such claims are unsubstantiated by current scientific evidence within the scope of clinical aromatherapy and can create unrealistic expectations, potentially delaying or deterring the client from seeking appropriate mental health support. This oversteps the evidence-based practice expected within the CAP framework. Professional reasoning. Professionals should employ a decision-making process that begins with active listening to understand the client's stated needs and concerns. They must then assess these needs against their defined scope of practice, as per the CAP regulatory framework. If a client's needs extend beyond aromatherapy, the professional ethical obligation is to refer the client to a qualified mental health professional. Communication should be clear, transparent, and focused on what aromatherapy can safely and effectively offer, always prioritizing client safety and well-being within the established professional boundaries. Question 15. Stakeholder feedback indicates a growing interest among clients in using aromatherapy for managing symptoms associated with chronic respiratory conditions like asthma and COPD. When a client presents with such a condition, what is the most appropriate best practice approach for a clinical aromatherapy professional (CAP) to adopt? Option A. Recommend a blend of essential oils that are commonly cited in popular aromatherapy literature for respiratory support, based on anecdotal evidence of their effectiveness in similar conditions, without further detailed medical assessment. Option B. Suggest a selection of essential oils known for their strong aromas, assuming that a more potent scent will provide greater relief for respiratory congestion, and instruct the client to use them via direct inhalation without inquiring about pre-existing sensitivities or medical advice. Option C. Conduct a comprehensive client assessment to understand the specific respiratory condition, medical history, and current treatments. Then recommend essential oils with a strong evidence base for symptomatic relief and general well-being, clearly outlining limitations and potential contraindications, and emphasizing aromatherapy as a complementary therapy. Option D. Advise the client that aromatherapy can effectively cure or significantly reduce the severity of their chronic respiratory condition, and provide a protocol for daily use of specific essential oils to achieve this outcome. Correct answer is C. Conduct a comprehensive client assessment to understand the specific respiratory condition, medical history, and current treatments. Then recommend essential oils with a strong evidence base for symptomatic relief and general well-being, clearly outlining limitations and potential contraindications, and emphasizing aromatherapy as a complementary therapy. Explanation. The scenario presents a common challenge in clinical aromatherapy, balancing client expectations and anecdotal evidence with the need for evidence-based practice and adherence to professional standards. Clients often seek aromatherapy for respiratory conditions based on personal experiences or information from non-regulated sources, which may not align with current scientific understanding or regulatory guidelines for professional practice. The challenge lies in providing safe, effective, and ethically sound recommendations while respecting the client's autonomy and desire for complementary therapies. The correct approach represents best professional practice because it prioritizes client safety and well-being by grounding recommendations in scientific evidence and established clinical guidelines for respiratory conditions. This involves a thorough assessment of the client's specific respiratory issue, including medical history, current treatments, and contraindications. It also necessitates a nuanced understanding of the evidence base for specific essential oils and their application methods in respiratory support, acknowledging limitations and potential risks. Adhering to professional scope of practice, which excludes diagnosing or treating medical conditions, is paramount. This approach ensures that aromatherapy is used as a complementary therapy, supporting general well-being and symptom management, rather than as a standalone medical treatment. It aligns with ethical principles of beneficence, non-maleficence, and informed consent, ensuring clients receive accurate information and make informed decisions about their care. An incorrect approach that relies solely on anecdotal evidence or testimonials without critical evaluation fails to uphold the principle of evidence-based practice. This can lead to recommendations that are ineffective or potentially harmful, as anecdotal reports do not account for individual variability, placebo effects, or interactions with conventional medical treatments. Such an approach risks misrepresenting the efficacy of aromatherapy and could lead to clients delaying or foregoing necessary medical care. Another incorrect approach that involves making definitive claims about curing or treating specific respiratory diseases directly violates the professional scope of practice for clinical aromatherapists. Aromatherapy is not a substitute for medical diagnosis or treatment. Making such claims constitutes professional misconduct and can have serious legal and ethical repercussions, including potential harm to the client. A further incorrect approach that neglects to consider potential contraindications or adverse reactions to essential oils, such as those with asthma or specific sensitivities, is a significant ethical and safety failure. Best practice demands a comprehensive risk assessment for each client, ensuring that chosen essential oils and application methods are safe and appropriate for their individual health status. The professional decision-making process for similar situations should involve a systematic approach. 1. Client assessment. Conduct a thorough intake, gathering detailed information about the respiratory condition, medical history, current medications, allergies, and lifestyle. 2. Evidence review. Critically evaluate the scientific literature and established guidelines regarding the use of aromatherapy for the specific respiratory condition. 3. Risk assessment. Identify potential contraindications, adverse reactions, and drug interactions for the client. 4. Scope of practice. Determine what can be safely and ethically offered within the scope of clinical aromatherapy, focusing on supportive care and symptom management. 5. Informed consent. Clearly communicate the potential benefits, limitations, risks, and evidence base for any recommended aromatherapy interventions to the client. 6. Collaboration. If appropriate, encourage the client to discuss complementary therapies with their primary healthcare provider. 7. Documentation. Maintain accurate and detailed records of the assessment, recommendations, and client discussions. Question 16. The assessment process reveals a client diagnosed with generalized anxiety disorder is seeking to incorporate aromatherapy into their treatment plan, alongside their current psychotherapy and prescribed medication. What is the most appropriate and ethically sound approach for a clinical aromatherapist to take in this situation? Option A. Immediately recommend a blend of lavender and chamomile essential oils for diffusion, as these are commonly associated with relaxation. Option B. Suggest the client discontinue their prescribed medication and rely solely on aromatherapy for anxiety management. Option C. Collaborate with the client's psychotherapist to understand the client's specific symptoms and treatment goals, and to ensure any proposed aromatherapy interventions are complementary and safe before discussing options with the client. Option D. Advise the client that aromatherapy is not scientifically proven to be effective for anxiety and therefore cannot be recommended. The correct answer is C. Collaborate with the client's psychotherapist to understand the client's specific symptoms and treatment goals, and to ensure any proposed aromatherapy interventions are complementary and safe before discussing options with the client. Explanation. The scenario presents a common challenge in clinical aromatherapy, integrating complementary therapies into established mental health treatment plans. The professional challenge lies in ensuring that the integration is evidence-based, client-centered, and adheres strictly to the scope of practice and ethical guidelines governing both mental health professionals and clinical aromatherapists. This requires careful consideration of potential interactions, client safety, and the need for informed consent, all within the existing regulatory framework for clinical aromatherapy practice. The correct approach represents best professional practice because it prioritizes a collaborative, evidence-informed, and client-led integration. This aligns with ethical principles of beneficence and non-maleficence, ensuring that aromatherapy is used to support, not replace, conventional mental health treatment. It also respects the client's autonomy by involving them in the decision-making process and ensuring they understand the role and limitations of aromatherapy. Furthermore, it upholds professional standards by seeking consultation with the primary mental health provider, fostering interdisciplinary communication, and ensuring that the aromatherapy intervention is congruent with the overall treatment plan and does not introduce any contraindications or risks. This approach is grounded in the understanding that clinical aromatherapy is a complementary therapy, and its application must be carefully considered within the broader context of the client's care. An incorrect approach that involves unilaterally recommending specific essential oils for anxiety without consulting the client's mental health provider fails to uphold the principle of interdisciplinary collaboration. This can lead to potential contraindications or interactions with prescribed medications, posing a risk to the client's well-being. It also bypasses the essential step of obtaining informed consent regarding the use of aromatherapy as an adjunct therapy, which is an ethical imperative. Another incorrect approach, which is to dismiss aromatherapy as a viable adjunct therapy due to a lack of personal familiarity, demonstrates a failure to stay abreast of evidence-based complementary practices. A caution is warranted. A blanket dismissal without exploring potential benefits or seeking further information can limit client options and may not align with the evolving landscape of mental health support. It also fails to engage in a professional dialogue about evidence-based complementary therapies. Finally, an approach that involves recommending essential oils for severe depression without a clear understanding of the client's specific symptoms, medication regimen, and the potential for essential oil interactions with psychotropic medications is a significant ethical and professional failing. This demonstrates a lack of due diligence and a disregard for client safety, potentially leading to adverse effects or interference with prescribed treatments. It also oversteps the boundaries of safe and responsible clinical aromatherapy practice by making recommendations without adequate assessment and consultation. Professionals should adopt a decision-making process that begins with a thorough client assessment, including understanding their current mental health diagnosis, treatment plan, and any existing therapies. This is followed by a review of current scientific literature regarding the efficacy and safety of specific essential oils for the client's condition. Crucially, consultation with the client's primary mental health provider is essential to ensure a holistic and integrated approach. Informed consent, clearly outlining the role, benefits, risks, and limitations of aromatherapy, must be obtained from the client before any intervention. Ongoing monitoring of the client's response and open communication with the mental health team are vital throughout the process. Question 17. Strategic planning requires a clinical aromatherapy professional, CAP, to develop a safe and effective approach for using essential oils to support a patient in palliative care experiencing significant distress related to breathlessness and anxiety. Considering the patient's complex medical history, including a recent cardiac event and current use of opioid analgesics, what is the most appropriate initial step for the CAP? Option A. Advise the patient to discontinue their opioid analgesics, as essential oils can provide a more natural and effective form of pain and anxiety relief. Option B. Immediately introduce a blend of essential oils known for their respiratory support, such as eucalyptus and peppermint, to address the breathlessness, without further consultation. Option C. Conduct a thorough assessment of the patient's specific symptoms, medical history, current medications, and personal preferences, and then consult relevant evidence-based research and professional guidelines to identify potentially beneficial and safe essential oils, followed by consultation with the palliative care team. Option D. Select a single essential oil commonly associated with relaxation, such as lavender, and recommend its use via diffusion in the patient's room to alleviate anxiety. The correct answer is C. Conduct a thorough assessment of the patient's specific symptoms, medical history, current medications, and personal preferences, and then consult relevant evidence-based research and professional guidelines to identify potentially beneficial and safe essential oils, followed by consultation with the palliative care team. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a vulnerable patient population in palliative care, where the primary goal is comfort and quality of life. Decisions about essential oil use must be evidence-based, safe, and ethically sound, respecting patient autonomy and the interdisciplinary team's care plan. The challenge lies in balancing potential benefits with risks, ensuring appropriate dilution, understanding contraindications, and communicating effectively with the patient, family, and healthcare team. Correct approach analysis. The correct approach prioritizes a comprehensive, individualized assessment and a collaborative, evidence-informed strategy. This aligns with best professional practice by ensuring that any intervention, including essential oil use, is tailored to the patient's specific needs, symptoms, and medical history. It emphasizes safety through appropriate dilution and consideration of contraindication, an ethical practice by obtaining informed consent and integrating the aromatherapy plan with the broader palliative care team. This approach respects the professional scope of practice for a clinical aromatherapy professional, CAP, within the regulatory framework, which mandates evidence-based practice and patient-centered care. Incorrect approaches analysis. An approach that focuses solely on a single essential oil for a broad symptom like anxiety, without a thorough assessment, is ethically and professionally deficient. It fails to acknowledge the diverse causes of anxiety in palliative care and the potential for individual reactions or contraindications. This bypasses the requirement for individualized care and informed consent, potentially leading to ineffective or harmful outcomes. An approach that disregards the patient's existing medical conditions and prescribed medications is a significant regulatory and ethical failure. Essential oils can interact with medications or exacerbate certain health issues. A CAP must operate within their scope of practice, which includes understanding potential contraindications and interactions, and collaborating with the medical team to ensure safety. This approach demonstrates a lack of due diligence and a failure to uphold the duty of care. An approach that relies on anecdotal evidence or personal preference without consulting current research or professional guidelines is professionally unsound. While personal experience can inform practice, it cannot replace the need for evidence-based decision-making, especially in a clinical setting. This approach risks using essential oils in a manner that is not supported by scientific literature, potentially leading to suboptimal outcomes or harm, and failing to meet the standards of professional practice expected of a CAP. Professional reasoning. When faced with a palliative care scenario involving essential oils, a CAP should employ a systematic decision-making process. This begins with a thorough assessment of the patient's symptoms, medical history, current treatments, and personal preferences. Next, the CAP should consult relevant, up-to-date research and professional guidelines to identify essential oils that have demonstrated efficacy and safety for the identified symptoms in palliative care. This is followed by a risk-benefit analysis, considering potential contraindications, drug interactions, and individual sensitivities. Crucially, the CAP must then communicate their findings and proposed plan to the patient, family, and the interdisciplinary healthcare team, obtaining informed consent before proceeding. This collaborative and evidence-based approach ensures that essential oil therapy is integrated safely and effectively into the patient's overall care plan, respecting professional boundaries and ethical obligations. Question 18. Cost-benefit analysis shows that while internal use of certain essential oils might offer perceived rapid systemic effects, the associated risks and stringent regulatory limitations for CAPs necessitate a cautious approach. Considering the regulatory framework for clinical aromatherapy professionals, CAP, which of the following represents the most appropriate and professionally responsible method of application for a client seeking relief from mild anxiety without contraindications for topical use? Option A. Advising the client to inhale essential oils directly from the bottle for maximum potency. Option B. Suggesting the ingestion of a few drops of a specific essential oil in water, as this is often promoted for rapid anxiety relief. Option C. Recommending a carefully formulated blend of essential oils for topical application, diluted in an appropriate carrier oil, to be applied to pulse points or the chest. Option D. Recommending the use of a diffuser with a high concentration of essential oils in a small, enclosed space for extended periods. The correct answer is C. Recommending a carefully formulated blend of essential oils for topical application, diluted in an appropriate carrier oil, to be applied to pulse points or the chest. Explanation. This scenario presents a professional challenge because a client is seeking a method of essential oil application that carries inherent risks, particularly if not managed with strict adherence to professional guidelines and regulatory frameworks. The challenge lies in balancing the client's expressed preference with the practitioner's responsibility to ensure safety and efficacy, all within the defined scope of practice for a clinical aromatherapy professional CAP. Careful judgment is required to assess the client's stated need against the potential for harm, and to guide them towards the safest and most appropriate therapeutic approach. Correct approach represents best professional practice because it prioritizes client safety and informed consent, aligning with the core ethical principles of healthcare and the specific regulatory framework governing CAPs. By recommending a method of application that is demonstrably safer and within the established guidelines for clinical aromatherapy, the practitioner upholds their professional duty of care. This approach involves a thorough assessment of the client's condition, contraindications, and potential interactions, ensuring that the chosen method of application is evidence-informed and appropriate for their specific needs, thereby minimizing risk and maximizing therapeutic benefit. This aligns with the CAP's responsibility to practice within their scope and to avoid making unsubstantiated claims or recommending potentially harmful practices. An incorrect approach that suggests internal use of essential oils without explicit, specific regulatory approval and robust scientific evidence for the particular oil and condition would represent a significant regulatory and ethical failure. The CAP regulatory framework strictly limits the internal use of essential oils to specific circumstances and often requires specialized training and explicit authorization, which is typically not a standard offering for general clinical aromatherapy practice. Recommending such use without these prerequisites would violate the principle of practicing within one scope and could lead to serious adverse events, contravening the duty to do no harm. Another incorrect approach that involves topical application of undiluted essential oils for a sensitive skin condition without proper dilution guidelines or patch testing would also be a regulatory and ethical failure. While topical application is a common method, the CAP framework emphasizes safe dilution ratios and consideration of individual skin sensitivity. Failing to adhere to these guidelines could result in skin irritation, sensitization, or other adverse reactions, demonstrating a lack of due diligence and a failure to uphold professional standards for safe application. The professional decision-making process for similar situations should involve a systematic approach. 1. Client assessment. Thoroughly understand the client's condition, history, and stated preferences. 2. Risk-benefit evaluation. Analyze the potential benefits and risks associated with each method of application for the specific client and condition. 3. Regulatory compliance check. Ensure that any proposed method of application aligns strictly with the CAP regulatory framework, including scope of practice, approved methods, and any specific contraindications or warnings. 4. Evidence-informed practice. Base recommendations on current scientific evidence and established best practices within clinical aromatherapy. 5. Informed consent. Clearly communicate the risks, benefits, and alternatives of any recommended approach to the client, ensuring they can make an informed decision. 6. Professional judgment. Apply clinical expertise and ethical reasoning to guide the decision-making process, prioritizing client safety and well-being above all else. Question 19. Compliance review shows a clinical aromatherapist is selecting essential oils for client treatment. Which of the following approaches demonstrates the most rigorous adherence to quality standards and professional practice for essential oils? Option A. Selecting essential oils based on the supplier's reputation for natural products, assuming all oils from a specific plant species are therapeutically equivalent. Option B. Relying on the essential oil's aroma and visual appearance as primary indicators of its therapeutic quality and suitability for clinical use. Option C. Verifying the botanical name, extraction method, and reviewing the certificate of analysis, Co-A, for chemical constituents and purity from a reputable supplier. Option D. Prioritizing essential oils with extensive marketing, highlighting their broad therapeutic applications and natural origins. The correct answer is D. Prioritizing essential oils with extensive marketing, highlighting their broad therapeutic applications and natural origins. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in essential oil quality and the potential for misrepresentation. A clinical aromatherapist must navigate the complex landscape of essential oil sourcing, extraction, and standardization to ensure client safety and therapeutic efficacy. Failure to do so can lead to adverse reactions, ineffective treatment, and a breach of professional standards. The challenge lies in discerning genuine quality from marketing claims and understanding the scientific basis for extraction methods and their impact on the final product. Correct approach analysis. The correct approach prioritizes a thorough understanding of the essential oil's origin, extraction method, and adherence to recognized quality standards. This aligns with the ethical imperative to provide safe and effective care. Specifically, it involves verifying the botanical species, the part of the plant used, the extraction method, e.g., steam distillation, cold pressing, and the presence of a certificate of analysis, Co-A, that details the chemical constituents and purity. This diligence ensures the essential oil is appropriate for clinical use and meets the expected therapeutic profile, directly supporting the principles of responsible aromatherapy practice as outlined by professional bodies. Incorrect approaches analysis. One incorrect approach involves relying solely on the essential oil's purported therapeutic benefits as advertised by the supplier without independent verification. This is a regulatory and ethical failure because it bypasses the necessary due diligence required to ensure product quality and safety. It assumes marketing claims equate to verifiable standards, which is not always the case. This can lead to the use of adulterated or inferior oils, posing risks to clients. Another incorrect approach is to assume all essential oils from a particular botanical species are of equal quality, regardless of extraction method or supplier. This is a failure to recognize the significant impact of extraction techniques on the chemical profile and therapeutic properties of an essential oil. Different methods can yield oils with varying concentrations of key constituents or introduce unwanted byproducts, making a blanket assumption professionally unsound and potentially unsafe. A third incorrect approach is to disregard the importance of a certificate of analysis, Co-A, believing that visual inspection or scent alone is sufficient to determine quality. This is a critical regulatory and ethical lapse. A COA provides objective, scientifically validated data on the essential oil's chemical composition, purity, and potential contaminants. Relying on subjective assessment is insufficient for clinical decision-making and fails to meet the standards of evidence-based practice expected in professional aromatherapy. Professional reasoning. Professionals should adopt a systematic approach to essential oil selection. This involves 1. Identifying the specific therapeutic need. 2. Researching essential oils known to address that need, considering their botanical identity and common extraction methods. 3. Sourcing oils from reputable suppliers who provide detailed product information, including botanical name, part of the plant, extraction method, and country of origin. 4. Critically reviewing the certificate of analysis, Co-A, for each essential oil looking for key constituents purity and absence of adulterants. 5. Considering the supplier's reputation and any third-party certifications. This multifaceted approach ensures informed decision-making, prioritizing client safety and therapeutic outcomes. Question 20. System analysis indicates that a clinical aromatherapy professional, CAP, is consulting with a new client who reports a history of asthma and currently experiences mild seasonal allergies. The CAP needs to determine the most appropriate aromatherapy technique for this client's general well-being. Which of the following approaches best reflects safe and ethical professional practice within the CAP regulatory framework? Option A. Suggests steam inhalation with several drops of eucalyptus and peppermint essential oils to help clear the airways. Option B. Propose a vigorous massage using a potent blend of essential oils to address general tension. Option C. Recommend a gentle diffusion of a single, mild essential oil known for its calming properties in a well-ventilated room for short periods. Option D. Advise the client to apply undiluted essential oils directly to the chest area for maximum absorption. The correct answer is C. Recommend a gentle diffusion of a single, mild essential oil known for its calming properties in a well-ventilated room for short periods. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the clinical aromatherapy professional, CAP, to assess the suitability of a specific aromatherapy technique for a client with a pre-existing respiratory condition. The challenge lies in balancing the potential benefits of aromatherapy with the inherent risks associated with certain application methods, particularly when a client has a compromised respiratory system. Careful judgment is required to ensure client safety and adherence to professional scope of practice. Correct approach analysis. The correct approach involves a thorough client assessment, including a detailed review of their medical history and current respiratory status, followed by the selection of a safe and appropriate aromatherapy technique. This aligns with best professional practice by prioritizing client well-being and safety. Specifically, it adheres to the ethical principle of non-maleficence, do no harm, and the professional guidelines that mandate individualized care plans based on client needs and contraindications. The chosen technique should be one that minimizes direct inhalation of concentrated essential oils, such as a gentle diffusion in a well-ventilated area or topical application diluted appropriately, rather than methods that could exacerbate respiratory distress. Incorrect approaches analysis. One incorrect approach involves proceeding with a technique that involves direct, intense inhalation of essential oils, such as steam inhalation with undiluted essential oils, without a comprehensive assessment of the client's respiratory condition. This is a regulatory and ethical failure because it disregards known contraindications for individuals with respiratory issues, potentially causing harm. It violates the duty of care and the principle of informed consent, as the client may not be fully aware of the risks associated with this method given their condition. Another incorrect approach is to recommend a technique that is outside the scope of practice for a CAP, such as prescribing a specific essential oil blend for a medical condition without consulting with the client's physician. This is a regulatory failure as it infringes upon the practice of medicine and a significant ethical breach, as it can lead to misdiagnosis or delayed appropriate medical treatment. A third incorrect approach is to dismiss the client's respiratory condition as irrelevant to aromatherapy application and proceed with a standard technique without any modification. This demonstrates a lack of professional diligence and a failure to recognize the importance of client-specific contraindications, which is a breach of ethical practice and professional standards. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive client intake and assessment. This includes gathering detailed medical history, understanding current health status, and identifying any contraindications or precautions. Following the assessment, professionals must consult relevant evidence-based resources and professional guidelines to determine the safest and most effective aromatherapy techniques for the individual client. If there is any doubt, or if the client has a complex medical condition, consultation with the client's healthcare provider is paramount. The decision-making process should always prioritize client safety, ethical conduct, and adherence to the established scope of practice for a clinical aromatherapy professional.